Guys, I'm glad this talk is not about stress today because I would not be a very good example of talking about stress. I've been on the side of the highway trying to make sure my presentation went through. I sent it yesterday, thought it went through. Oh, no. But I'm no IT person, so it's probably all my fault. So good morning, everybody. How's everybody doing this morning? Good? Okay. Well, very basic presentation today, very basic display. We're going to talk about hydration and kidney health. And we're going to start with hydration. These are two separate presentations, but they're both short. And there is going to be a little bit of overlap. But we'll get started with talking about hydration. You guys probably already know a lot of this. I asked during my last presentation, what's the largest organ in the body? Skin. Someone said skin, and that's the right answer. And so hydration, think about our skin. We lose a lot of our fluid from our body out of our skin, even when we're not thinking about it. Even when you say, well, I don't sweat. You do. We all do. And we lose that from our skin. So our body is made up of 60% water. We should be drinking plenty of water each day to help all of our cells function appropriately. We lose fluid through sweat. I will even go on a little bit further to say, even if you don't think you're sweating, how many of you keep your apartment or your home at 74 degrees or higher? Yeah, so a lot of people. I've been into a few of your apartments when I've been invited in to check on a medicine bottle or something, and there was one that was 80 degrees. And I was about to die, but I understand that as we age and a lot of people are on blood thinners, they feel like they stay cold, and so they crank the temperature up in the apartment or the home. They may not feel like they're sweating, but they are losing moisture out of their body to those higher temperatures. And so keeping your apartment or home at a higher temperature means you're gonna lose more fluid from your skin. We are going to talk about water, and I brought water today, and I brought some hydration packets to share with everyone and some flavoring that you can use for your water, but we're also going to talk about the foods that hydrate you also, and there's a long list of them. You can imagine watermelon is one of them, and thanks to our bistro, they keep us well stocked on watermelon this time of year. Hydration is very important for all of our functioning of our body, for our cellular function, for our metabolism. So, a lot of people will say, I just can't lose weight. Why can't I lose this weight? How much water are you drinking? We don't need to take in calories from our beverages. You need clear water to help your kidneys function and all of your other organs. So you want to make sure that you're getting plenty of clear water and limiting other beverages that you might drink. Water aids in our digestion and nutrient absorption. If you take vitamins, if you take supplements, and you put them on your stomach in an empty barrel, basically, and there's nothing in there, that's going to be hard for the body to absorb that out into the bloodstream. So you're going to need to drink plenty of water when taking your medications, and so it can help break down and digest the vitamins and supplements that you're taking. Water is important in regulating our body temperature. When someone's hot, what's the first thing we offer them? Water. Maybe an ice pack also on the back of the neck, but water's one of the first things that we offer. Here's another common problem in anyone who's above the age of 45, is lubricating our joints. So how many of you have joint pain? You wake up and your hip is stiff, your knee is stiff, your ankles are tight. If you think about the fluid that's between those joints, it needs water to be able to be nice and lubricating. So you want to drink water for those purposes. It also maintains our skin health. When people are dehydrated and are not full of water, our skin is going to look a little bit more wrinkly, a little bit more saggy. You can pull up the skin on the back of your hand to test your hydration. You can also do it on the back of your knuckle. So with your fingers flat, pull it up on the back of one of your knuckles. If it stays up like a tent, it's called tenting, and that means you don't have as much fluid in your body. I'm a little dehydrated this morning, so I know mine's not great yet. One of the challenges that I talk about, and I've mentioned probably in most of my presentations, is as we age, we lose our sense of thirst. So I even hear that from some of you. Some of you go, well, I drink at mealtime, but I just don't get thirsty. I don't want anything. So I don't go and seek out beverages. I don't go out and seek out water. And it's because your body, as we age, just doesn't give us those signals that we need to drink. So I tell people, set a timer on your watch, set a timer on your telephone, have a kitchen timer in your apartment, something that about every 15 minutes or every 30 minutes, you get a signal to say, I need to go have a drink of water. And it doesn't have to be a whole cup, but 2 big gulps of water every 30 minutes is going to be very hydrating for your body throughout the day, and that's going to get you more ounces of water than it would if you only drink at breakfast, lunch, and dinner time. So make sure you're drinking throughout the day. Medication side effects can cause dehydration. We'll talk about that in a little bit, about some of the medicines that tend to cause people to urinate. Some of them are diuretics that are designed to get fluid out of your body. So you're losing fluid, but you still have to replace that fluid. Mobility issues are a problem. People say, I cannot get up and walk to the sink that many times a day, Lori. Just don't make me do it. Every 30 minutes? Really? I can't do that. In which case, that's when we talk about having an insulated water bottle or plastic water bottles, something nearby that you can carry with you or have with you at all times, or first thing in the morning, fill up your water bottle to go and set it beside of the recliner or to put it with your rollator, wherever you're going to be that day. Cognitive decline, so memory issues can cause people to become dehydrated. Not only the fact that most of those people have lost their sense of thirst, so they don't know that they need water, but they just don't know where to get it. They don't know to go to the sink or to go to the refrigerator and get it. Another problem is, I'm going to use just a bottle as an example. If you have a clear glass or a clear cup and you put water in it, from 1 foot away, 2 feet away, can you tell that there's water in that clear glass? You really can't. I mean, most of us, yes. But if you have memory issues, you might look at that and think that that glass is empty because it's translucent, it's clear. You can't see that water line at the top of that glass or cup. So people with cognitive decline benefit from drinking out of a colored glass or a colored cup, something like a red, orange, blue, green, still a translucent cup, still one that you can see through, but when you put water into a blue cup, a red cup, that for someone who has some memory and cognitive problems, they can actually distinctly see the liquid line at the top of it, and then they know, oh, that glass isn't empty. Here, I'll take a swallow. So that's something to think about with cognitive decline, is purchasing colored cups or glasses for individuals. I like drinking out of a straw. I feel like I get more. When you take a slurp out of a straw, you usually fill your whole mouth with fluid before you swallow it. You don't just take this little tiny sip. So I like drinking out of a straw because that's going to increase your hydration as well. Also talking about cups, glasses, water bottles. They make water bottles that have straps on them, so you can be hands-free. You can wear them for women or men. You can wear them sort of like a crossbody, just hanging on your hip so that it's always with you, but you can still push your rollator. You can still be hands-free, so you're not at a fall risk by carrying something like that. You can carry it around the front part of your chest. So think about ways to work around our excuses. You know, some people say, well, I can't carry a water bottle around with me all day. No, you can't, but I see Miss Moore, she has a cup holder on her rollator. I love rollators because everyone tells me that in the bistro, it's so handy to put your tray, put your things that you're going to take back home or to your table right there on your rollator. So being hands-free is very important. Just chronic health conditions also cause a challenge for our patients with getting hydrated. I actually have heard from more than 3 men this week, either by phone, in person, or in the hallway, who have said, I can't wait to attend your talk on Thursday and hear how you're going to tell me to stay hydrated, but how to stay out of the bathroom. And I think that goes for women too. But a well-known chronic medical condition for men is an enlarged prostate, especially later in life. And so an enlarged prostate causes men to feel like they have to urinate more frequently. They might get up 2 times a night. They might get up 5 times a night. It's very different for each patient. And so staying hydrated is difficult because even hydration during the day is going to make you go to the bathroom. Just know that it's a balancing act. And so while you're losing urine, that is fluid out of your body, and you've got to replace it. And I have actually had some patients, I'm not saying this is a recommendation for one size fits all, but I have had some patients tell me that they will use electrolytes before bedtime or in the evening, and they don't tend to get up as much at night. And my theory, I'm not a nephrologist or a urologist, but my thought is most of these hydration packets have some degree of salt in them, sodium. Sodium is going to make you retain fluid. And so you can try it. However, I'm not promising that works for everyone, but I have had some people tell me that by having some electrolytes maybe in the evening, 6 o'clock to maybe 8 o'clock, that helps them to retain more fluid through the night hours when they are usually getting up to go to the bathroom. It's a catch-22 because at the same time, the more fluid you take in the evening, what are you going to do throughout the night? Going to get up to go to the bathroom. We'll talk about alcohol and how alcohol plays a role in our kidney health and hydration in just a little bit. But symptoms of dehydration, think about this. Dry mouth, dry skin. If your skin is really dry, sure, you just may need some lotion or cream, but it also may be because you just don't have enough fluid out into your tissues. Fatigue, that's one of the things. Dizziness, not every dizzy person is dehydrated. There's other reasons for dizziness. Headaches, not every headache is dehydration, but that's one of the first questions we ask is, are you getting enough fluid? Are you drinking enough? Confusion can be a symptom of dehydration. We do tend to see that as we age. I will have patients come in and just say, I'm not feeling myself, or their family member says, they're just not acting right. Can you check and see if they have a urinary tract infection? And while that is oftentimes the case, sometimes it's that the urine is dark and there's other symptoms of dehydration. It's just that we need to get that person hydrated. Another symptom is decreased urination, not going to the bathroom very often. We all know that in the beginning, the morning urine is probably going to be your darkest urine of the day because for most people, if you're not getting up and emptying your bladder, then that urine has been sitting there through the night and it's more concentrated. It may be darker yellow, orangey, brown. So that's where we tend to see that as a symptom of dehydration when you notice dark urine. If you are well hydrated throughout the day, when you go to the restroom and you look down, it really should be a very, very light color. It should be a very pale yellow. It should not look like you poured sweet tea into the toilet. Sweet tea in the toilet, it means you're too dehydrated. Muscle cramps are another symptom of dehydration. So that's one thing that I know a lot of my patients experience, are leg cramps at night, muscle cramps. Some of that is tendons get shorter as we age, and so it pulls those muscles, which then cause muscle cramps. So there's a lot of need for stretching and exercising, but hydration is also the key. I think about the kidneys and the muscles as a dry sponge. Think about a dish sponge, and you leave it on the counter and it dries out. That's hard, it's crunchy. It's gonna work better when you pour water over it and you get that sponge nice and moist, right? So that's how our muscles work. The muscle fibers are gonna slide and stretch a lot easier if those muscles are hydrated. If those kidneys are hydrated, they're gonna work a lot better. So that's why we talk about hydration and the importance of hydration so much. If you're dehydrated, you have an increased risk of urinary tract infections. We'll talk about that in my next set of slides also. You have an increased risk of kidney stones. Again, a dry kitchen sponge is like a stone, right? It's very hard, very crunchy. You can't pass kidney stones when they're super large or really dried out. So often the urologist will say, to pass this kidney stone, I need you to force fluids. And they mean clear fluids. Drink a lot of those clear fluids. And they usually will also give you medication to try to help you pass it, both pain medicine and also a medicine to allow it to pass through the pathways of the urinary system. Constipation is a symptom of dehydration. Not every person who's constipated is dehydrated, so it's sort of, this is not a one size fits all, but the stool needs to be soft. It needs to be moistened in order to pass more easily through the intestines and through the colon. So you want to make sure that you're drinking plenty of water to stay hydrated to help with constipation. Heat stroke is a risk of dehydration, so becoming overheated. Our body likes to stay a nice temperature, a nice uniform body temperature. And so if you're outside working, getting overheated, then that can cause dehydration, which then can lead to a heat stroke. Dehydration also leads to low blood pressure, and then low blood pressure can lead to people falling more. So that's why we carefully want to hydrate, keep our blood pressure elevated. If you were dehydrated or your blood pressure's low and you're in an emergency room, what are they gonna do? They're gonna put an IV in your hand or an IV in your arm, and they're gonna hang bags of fluid. That fluid is getting right to the source of where it needs to be. It needs to be in the bloodstream. And so with hydration orally, we're putting it in by our mouth. It has to go into our esophagus, into our stomach, into our small intestine before it's getting absorbed where it needs to be. So in emergent situations, we can't just tell someone to drink more water. That's not going to fix a problem quickly. IV fluids are often needed for severe cases. I mentioned we were going to talk a little bit more about kidney stones. So if you have small kidney stones, they'll recommend, the nephrologist or urologist will recommend drinking lots of water and perhaps taking pain medications or alpha blockers to help you pass the stone. Larger stones, though, may require surgery or lithotripsy to break it up into smaller stones so that you can pass it. But drinking lots of water and minimizing salt intake, minimizing your animal protein intake, all of those things can help reduce your risk of developing kidney stones. So how much water do we need? And you notice this is geared towards seniors. So what, 65 and older? I think most everyone in the room qualifies as that. But we need 6 to 8 cups per day. What's a cup? A cup is 8 ounces. So it doesn't mean you have to drink 6 to 8 large plastic cups or glasses a day, but it means you need at least 48 to 64 ounces of water a day. And ideally, it really should be double that. And I know that sounds like a lot. And yes, I agree, men and women, you won't be able to do anything else but run to the restroom. But it's going to hydrate all of your organs, all of your tissues, your skin. It's going to help with your kidney function. We'll talk in a little bit about some people who are on fluid restrictions and why we tell those people not to overdo the fluids, but that's in certain situations. You want to adjust your fluid intake based on your activity level. So if you're out, I know you guys aren't out mowing the grass, but if you're out gardening and you're out weeding your garden, planting flowers, you're out in the hot sun, you're going to lose more fluid, so you're going to need to take in more fluid on those days. Let's talk about blood draws. We've all experienced going in for blood work, and if you have good, great, large, bounding veins, that's wonderful, and the nurses love you. Tell them, Candy. So large veins, this is going to be great. This is going to be easy access. Some veins are very small, some roll, some collapse, but hydrating ahead of your blood tests are going to help you not to experience multiple sticks from the needles. It's going to help your phlebotomist or your nurse to find a vein and access it and draw the blood out more easily. And I usually tell people it's not the morning of hydration, it's actually the day or two beforehand. So if you know you're going to be having blood drawn, if you know that you are going in for some type of treatment where they're going to need to find IV access, you want to hydrate for a few days ahead of time. And then, of course, I know our staff says, be sure to drink plenty of water. So be sure to drink plenty of water the morning of your blood test, but also a day or two ahead of time. You can include other fluids and water-rich foods. We'll talk a little bit more about the foods in a little while. This is the key point here. Always talk to your provider about your fluid intake. Some patients are on limited fluid restrictions for diseases such as diabetes insipidus, sodium-related problems, cardiac disease, kidney disease, liver failure, and more. So there are health conditions that cause us to retain fluid. If your heart does not function appropriately and you have some degree of congestive heart failure, then you might be on a fluid restriction. Your doctor may have told you, do not drink more than a certain number of ounces per day. Those instructions usually come from the cardiologist, and those patients with heart failure are also weighing themselves every day. They're getting up in the morning, urinating, and getting on the scales to see what their weight is, and they're tracking their weight at the same time every day so that if they see an increase in their weight, they know, well, it's probably not just that I ate too much last night. It's probably that I'm retaining too much fluid. So if you have heart failure, you have to be careful about those things. So a couple more tips to stay hydrated. Carry a water bottle. Drink water with meals. This is something my family typically does, especially if we're going out to eat. I don't like to pay $3 for a tea. The bistro is great. I think it's like 70 cents or something. But I don't want to pay $2.50 for a Coke or a Diet Coke. So part of that's just being frugal, but if you force yourself to drink a glass of water or more than one glass when you have your meals, then you're already getting in some of your daily fluid requirements. Setting reminders, again, we talked about watches, phones, alarms in your apartment to trigger you to drink some water. I have even told people to keep a cup beside the sink in the bathroom. If you are one who gets up and goes to the bathroom 2 times, 3 times, 4 times a night, Get some cold water. Take 2 big sips of water before you go back to bed. And people go, why? Because that's just going to make me get up even more. Well, you're going to get up anyhow, right? Your pattern right now is that you're already getting up. And so while you're depositing fluid out of your body or eliminating fluid out of your body, you need to be depositing some extra fluid back in for your function of your organs. Water-rich foods, fruits, and vegetables are the key. So we'll talk a little bit more about which fruits and vegetables, and then monitor your urine as an indicator of whether you're dehydrated or not. So this slide talks about incorporating soups, smoothies, and herbal teas. I know some people say, I don't like water. I don't like the taste of it. It's bland. It doesn't have a taste. Or some people, because of a medication that they take, feel like water has a metallic taste. And they say, it tastes like metal. I can't drink that. Then we need to do something to alter the flavor of that water so that it's better tolerated. I brought some little samples. These are lime flavored. This is true lime. This is a lime wedge that has been crystallized and dried. They make true lemon. They make true orange. And there are no calories in this. This is just basically like squeezing a lime wedge into your water or into your glass. I do have orange ones in the clinic. I just forgot to grab that box from the clinic before I headed over. So feel free when you guys come up to take a pack of this true lime with you and try it out. You might like it, especially if you're not crazy about the flavor of water. I also brought Propel electrolyte packets. There's different flavors up here. We've got raspberry lemonade, strawberry kiwi, grape, and berry. So be sure to take one. I think there's about 40 up here, and I don't know how many people we have in the room. So maybe start out with just taking one of the Propels and one of the limes when you leave today to make sure everyone gets some. But that's an alternative to flavoring your water. Herbal teas are okay, but the darker the tea, the more dehydrating. So I do remind people that tea is made with water. You are getting water, but if there's caffeine in any of the teas that you're using, then you're actually counteracting some of that hydration benefit. You want to limit things like caffeine and alcohol, both of which are diuretics that make you go to the bathroom. Tea will make you go to the bathroom more than water will. Coke, Diet Coke, those things will make you go to the bathroom more than water will. So make sure if you're drinking multiple Cokes or glasses of tea a day that you're balancing that with just as many cups or bottles of water. When we talk about soups, notoriously canned soups are high in sodium. So soups can be, because of the way they make them, they have to put sodium in it as a preservative. And so sodium can actually dehydrate you. But if you are very dehydrated after a GI illness, what's one of the things we tell you to take? Some broth. Make some broth. And because when you're dehydrated, you want to hydrate with some sodium and fluid to help. So it needs to be a clear broth. So it needs to be something that if you put it in a clear glass and hold it up to the light, you can pretty much see through it. That's going to be the healthier broths. Some people make their own chicken stock. They make their own vegetable stock at home. So you can make your own stock. You start with a pot of water and you add onions or celery or whatever seasonings you want, and that's going to be hydrating. Balance your electrolyte intake. I tell people you don't need electrolytes all of the time. You really don't necessarily need them every day. If you are exercising and working out and sweating or working outdoors, gardening outdoors, then you might need extra electrolytes on those days. But not everyone needs extra electrolytes. If you have problems with high potassium levels, you have to read labels. And some of these things have too much potassium in them. Some of them have too much sodium. So you have to read your labels when you're looking at electrolyte packets. Gatorade is probably the most well-known electrolyte brand on the market. And then Propel is made by Gatorade. But there are other brands also. There's IV Hydration, there's Drip Drop. There's lots of different electrolyte supplements on the market. The one day I'm talking about hydration, I was going to use our water over there as an example. Typically, they flavor our water here for my presentations. Usually there's lemon slices or lime slices or oranges or berries in the water. And today, unless I'm seeing incorrectly, they just gave us straight water, which is fine. That's fine. Who is it? Jolene. Yes. Yeah, we're going to miss Jolene. Yeah. So we'll have to provide a little feedback and say, we're missing Jolene and we're missing the fruit in our water. Again, you can use water bottles to help track your intake and keep up with your ounces. Walmart, Target, a lot of places like that sell water bottles with the markings on them. So if you're aiming for 64 ounces a day, get you a water bottle that's 32 ounces, and you know that you need to drink 2 of those throughout the day. And that does not count coffee, that does not count tea, and that does not count alcohol. So alcohol, tea, soda, and coffee do not get to count towards your intake throughout the day. You want that to be plain water. It's hard, guys, I know. I'm up here preaching to the choir right now. It's hard to get that water intake in. Again, like I mentioned, you can flavor your water with fruits or herbs if you don't like the taste of plain water. But you just want to ensure that you have easy access to it. So again, people with mobility issues who maybe can't get around, make sure you're carrying that water bottle with you. Make sure you take it to the recliner. Make sure you have one at the nightstand. Maybe have a cup in the bathroom. Anything to help cut down on that. Anyone have any questions so far? Christine's going to get us switched over to the more kidney-focused discussion. It didn't lock you out, did it, Christine? Okay, I want to make sure my laptop didn't close her out. I'm going to call out a list of fruits and vegetables that are high in water content, and other foods also. I did a little bit further research this week. So if you're a note taker and you have a pen or paper, you can write some of these things down. So we already talked about watermelon, and the bistro is great to have watermelon in there for us. Strawberries. Think about those fruits that you bite into that all of a sudden you need a napkin because you've got juice going everywhere. That means they have a high water content. So watermelon, strawberries. Grapefruit is surprisingly very hydrating. Peaches, again, think about a juicy peach. Oranges and apples. And cantaloupe. Those are your top fruits that are going to be high in water content. And then vegetables, tomatoes, bell peppers, spinach, lettuce, cucumbers, celery, and zucchini. All of those are going to have more water content in them. We talked about soups and mostly clear broths, but non-fat Greek plain yogurt has about 80% water in it. And that's a pretty high water content. And people say, well, yeah, but have you tasted non-fat plain Greek yogurt? Yes, I have. And that's why you can drizzle a little honey. You can add some blueberries. You can add some strawberries, peaches to your yogurt. You don't have to buy the Greek yogurt that already has a lot of sugar content. You can sweeten it on your own, which I should have my 19-year-old son come and do a presentation because he is my health-focused health nut. And his morning, if you all saw what he fixed every morning for breakfast, you would just be astounded. One, my 19-year-old is 6'2", so I look up to him. But he usually makes 3 eggs for himself. He usually makes sourdough toast which he puts plain peanut butter on. And when I say plain peanut butter, there is no additives in that peanut butter. It is peanuts. That's it. There's no oil. There's no sugar. It's just the natural oil that comes in his container of peanut butter. He will use honey if he wants to drizzle a little honey over his piece of toast. And then he has a bowl of Siggy's yogurt. I think that's how you say it. I think that's how you pronounce it. He takes a big bowl of non-fat, plain yogurt, and he puts a little bit of honey over it, and then he throws in berries. And he often uses frozen berries. He'll just buy frozen blueberries, frozen strawberries, add them to his yogurt. While he's making his eggs, his berries are defrosting in his yogurt, and that's his breakfast every morning. I haven't even had breakfast today, and I think, where am I going wrong? I need this life of this 19-year-old. But definitely, those are things to think about. Cottage cheese also is 80% water. So cottage cheese is high in protein, high in water intake, and if you come to my clinic and we go over your blood work, that's two things I'm usually telling people: to increase your protein, increase your water intake. So that is something to think about for increasing fluid in your body. So this slideshow is also about kidney health. There's going to be a lot of duplications here over the hydration slideshow. So again, your kidneys have a big job. They remove toxins from your bloodstream. So when your kidneys do not work, when you have kidney failure, stage 5 kidney failure, that is when we're talking about dialysis. And what does dialysis do? Dialysis takes your blood and it filtrates your blood and removes the toxins from it and puts the blood back in your body. And so that is what dialysis is when you have stage 5 kidney failure. Our kidneys turn toxins into urine waste, which exits our body. Our kidneys help balance our fluid levels. They help control our blood pressure levels. They release hormones that produce red blood cells. So oftentimes you'll hear me say, if you're anemic, it could be from your kidneys. And people go, well, what do you mean? Do you mean I'm losing blood out of my kidneys? No, it means if your kidneys don't work great, then you can have chronic kidney disease, anemia that's related to your chronic kidney disease. So iron won't fix that. B12 won't fix that. Our kidneys also produce an active form of vitamin D, and so a lot of us are vitamin D deficient. Is that because your kidneys don't work? No, not completely. It may be because we dietarily are not getting in enough vitamin D or not out in the sun absorbing vitamin D, but so it doesn't all come from kidney problems, but that is one side effect of kidney disease. So again, our body's made up of 60% of water. We should be drinking it every day. We lose fluids every day. Even if you feel like you're not sweating, you are losing fluid, and you want to focus on foods and beverages that can hydrate you. This is the little short list: lettuce, cucumbers, watermelon, and celery, but we talked a few minutes ago about other fruits and vegetables. If you have kidney disease or you have high blood pressure, I'm sure you have heard before, limit your salt intake. Increased salt intake raises our blood pressure. So if you have low blood pressure, you're allowed to use the salt shaker. If you have high blood pressure, we encourage you not to add extra salt. Salt increases the blood pressure, and it can have a negative impact on your kidneys. It dries those kidneys out. It takes that wet sponge of a kidney, and it just dries those kidneys out. Exercising more, getting blood flowing. You want adequate, good blood flow to your kidneys. Eating less meat. Fruits and vegetables are going to be more hydrating than meat is, so you want to eat, you can eat meat, but we talked a few moments ago about animal protein. So too much protein and too much animal protein can lead to kidney disease. You want to get adequate amounts of sleep. You don't want to smoke. I don't think I've met a smoker here at River Landing yet, which is a good thing, but I know many people have a history of smoking. They smoked back in the day when that was the thing to do, and no one was warning you not to. And so if you're smoking, you do want to stop smoking. That's going to help improve blood flow to your kidneys. In terms of urinating, don't hold it. Retaining urine, trying to hold your urine into your body is going to make that urine more concentrated, and that could lead to a urinary tract infection. Not becoming too overweight, watching your weight is going to be healthy for your kidneys. So all those things. Stay hydrated, exercise, eat healthy, don't become obese. All of those things are going to be very important. Common kidney diseases. CKD is chronic kidney disease. You'll oftentimes see that on your chart in your doctor's office. I tell people don't become too alarmed. There are 5 stages of kidney disease, and the only way to be perfect is to have an eGFR that's greater than 90. That's your filtration rate, and 90 is a high number. I don't think mine's 90. So that's a big goal, to have yours above 90. Your kidney function fluctuates. We could check your labs one day and your eGFR could be 70. We could check it the next day and it could be 45. It's all based on how your kidneys are functioning and also your hydration level. We already talked a little bit about kidney stones as being a common kidney disease, so staying hydrated helps prevent those. Staying hydrated helps prevent kidney infections and urinary tract infections. Kidney cysts are common. Cysts can happen anywhere on our body. You can get an acne cyst, like a pimple. You can have a cyst anywhere if you have skin. You can have breast cyst. You can have kidney cyst. You can have liver cyst. Cysts are fluid-filled. So I always say cysts are not typically dangerous. That's just something that it just happens to be there and we watch it. But being, having kidney disease can contribute to that. I think the largest kidney cyst I've ever seen was about 8 centimeters. And it was surprisingly, patient was asymptomatic, didn't have any idea that they had this large kidney cyst, and it was detected on a CT scan. And the nephrologist and urologist said, it's fine, it doesn't matter, it's big, but there's nothing to do about it. We don't have to take it out. So, and kidney cancer is another common kidney disease. So if you keep seeing these pictures, these are your kidneys. They look like beans. You have 2, one on each side of your body, situated towards your flank. So if you ever are concerned about a kidney infection, oftentimes I will take my hand and tap or beat down your back to see if you jump out of your skin. That's called CVA tenderness, and if that's not diagnostic, but it gives you the idea that if someone is sensitive with that mild tapping on the back, it means that that kidney can be infected. So CKD is, again, a condition where kidneys have sustained damage, can no longer filter blood properly. Sometimes that damage comes from diabetes, high blood pressure, long-term obstruction of the urinary tract, whether it be from enlarged prostate or kidney stones, or maybe someone's had multiple kidney infections in the past and it has caused scar tissue or damage to the kidneys. So chronic kidney disease, I often tell people it's asymptomatic. Most people don't know that they have chronic kidney disease. It's not like you necessarily have one symptom that you can correlate with it. But here are some of the common signs or symptoms: nausea or vomiting, loss of appetite, cramps, sleep trouble, uncontrolled blood pressure, swelling in the feet or ankles, urinating more, maybe urinating less for some people. It's not a one-size-fits-all. Fatigue and muscle weakness, all of those could be possible symptoms of chronic kidney disease. Some types of chronic kidney disease can be treated, but usually not cured. Normally, once the kidneys are damaged, that's a long-term effect, and I tell people that's something that most people have to live with. I'm not a nephrologist, so I can't give you the rates of people who pass away from stage 5 renal failure every year, but there are treatments for some degrees of renal insufficiency. So to treat complications, typically we treat the underlying cause. If we think that's coming from high blood pressure, if we think that your kidney disease is coming from diabetes, then taking your medications appropriately are going to be recommended, keeping your cholesterol controlled and keeping any swelling under control. You want to make dietary changes. You may want to limit the amount of animal protein that you eat. If you have a high grade of chronic kidney disease, you'll have to have follow-up testing routinely. I've had people say, well, how do you know how my kidneys are functioning? You didn't take my urine. It's a blood test. So we do have urine tests that check for kidneys, but usually we're looking at looking for other abnormalities also, so we do urine tests. And then, of course, if you have anemia, we would want to treat that depending on what the cause of the anemia is. If complications cause too much damage, your doctor could recommend treatment for end-stage renal disease, such as dialysis, or some people are even considering kidney transplant if they're eligible. We talked earlier about kidney stones. So again, here, this is what a kidney is, and this is your ureter that goes down to your bladder. So a stone in the kidney would be a deposit, a collection of toxins that get lodged into the kidneys and can't pass. If they're small, they often do pass on their own. The number one symptom of kidney stones is pain. Most people have pain. The number 2 symptom is blood in their urine. So you very rarely ever have a stone moving through the kidneys that doesn't produce urine in the blood in the toilet. Because as that stone is moving, it's shredding, it's tearing, it's doing damage through the kidney and through the ureter, and so it is causing damage to the tissue, which then results in bleeding. So if you have bleeding, that is one thing we think about. Are you also having back pain? If so, then you probably have a kidney stone. Diet, increased calcium intake, increased uric acid can cause problems with kidney stones. So oftentimes people, if they have had kidney stones, the stones have been analyzed by the nephrologist and they have said you need to limit your calcium or you need to limit some other intake in your diet if they're able to localize what your stone came from. Keeping your weight under control will help limit kidney stones, and there's other medications, supplements, and medical conditions that can contribute. Again, you can have side or back pain, pain that comes and goes. I kind of describe it as colicky. You know, it hurts and then it eases off, almost like childbirth, those contractions. You know, you can have pain and then it eases off. You could have pain or burning while you're urinating, but if the stone is much higher, you necessarily wouldn't have that symptom. But pink, red, brown, or cloudy urine might suggest that you have a kidney stone that's moving. The persistent need to go to the bathroom, even if you haven't passed anything or you're not passing much urine when you go, that could mean that you have a stone that's lower down that's causing a blockage. And then, of course, if you have nausea or vomiting. I've never had a kidney stone, but I've given birth to a 9-pound baby naturally. And I don't know, I hear from some of the men that having a kidney stone is like childbirth. I don't know, is it? I've got heads nodding. Kidney stone treatment, if they're small, drink lots of water. Like we talked about earlier, you might take pain medication or alpha blockers, or large stones may need to be removed or busted up with a laser so that you can pass it. Minimizing salt, minimizing animal protein, and drinking lots of water can help reduce your risk. I know some of these are duplications from the last slides. Urinary tract infection. So this is a good example of the urinary system. So here's your kidney beans. They truly look like beans, one on the right and left side of your body. These are your ureters, these tubes. This is a magnifying glass, that big black thing she's holding. So that is not part of your urinary system. And then this is your bladder. What they don't show below this is the urinary tract. And so the urinary tract is what goes from your bladder to outside of your body. For a female, the urinary tract is short, right? From the bladder to outside of our body, there's not much room. So women are more likely to develop urinary tract infections than men. That's one of the reasons, because our anatomy is different. Men, you have a longer exit ramp. So from your bladder to the end of your penis is much longer, and so you don't tend to get as many urinary tract infections. Bacteria can't go up into that tract as easily as it can for a female. It can happen. You men can still get bladder infections, urinary tract infections, but it's just not as common. But that's the anatomy of what we're talking about when we're talking about kidneys and bladder infections and urinary tract infections. Causes of urinary tract infections and kidney infections, women are at a higher risk, but as we talked about, but men can get them too. Bacteria can enter up into that area. Sexual activity can increase the risk of UTIs. And then menopause. And a lot of people say, why menopause? What's that got to do with it? As women go through menopause, they lose their estrogen. They don't have those high levels of estrogen any longer. Estrogen helps prevent dryness in the vaginal area. The more dryness you have, the more friction and irritation and pain you can have, which then can track right up into the urinary tract. So back pain, fever, chills, nausea, vomiting are symptoms of kidney infection. Like I mentioned, I'm going to take my hand and beat on your back if I think that you have a kidney infection. Bladder infections are going to be lower down. They're going to be down here in the pelvis. So after I listen to your abdomen, I'm probably going to push right above your pelvic bone to see if you have pain or pressure. That could be symptomatic of a bladder infection. And then the urethra, which is your tract going out of your body, you could have discharge, you could have burning, or just that increased urgency to go. Again, look at this. Drink lots of water. How many times have we said that today? Drink lots of water. Most urinary tract infections can be treated with antibiotics. But I will tell you that there are a large number of patients who have some degree of bacteria in their urine at all times. It's not always it's not always bacteria that's going to cause a detrimental infection. That's why some people don't even know that they have one. They're asymptomatic. It's when you develop fever, it's when you develop pain and you're very symptomatic that we want to go ahead and treat with antibiotics. So that is when there's an increased risk for that bladder infection tracking up the ureters and becoming a kidney infection. So some of the ways to prevent that are to drink lots of water, and for women, that would be when you're cleaning yourself on the toilet, you wipe from the front to the back. You don't want to track any bacteria from the back to the front. That's something we all learned when we were potty training as little girls. And then after sexual intercourse, you want to make sure that you use the bathroom, urinate, that cleans out that urinary tract, and also drink some water. Again, kidney health is important to your overall health. It factors into many other diseases if you have chronic kidney disease. So you want to try to keep your kidneys as healthy as possible. The way we keep our kidneys kicking, drinking plenty of water, limiting salt, eating less meat, more fruits and vegetables, checking your blood pressure regularly, making sure that it's not elevated persistently. Stop smoking if you smoke, because tobacco can damage your kidneys further and raise your blood pressure. And alcohol intake. I know we haven't talked as much about alcohol, But alcohol is very dehydrating. And I know drinking alcohol is a rite of passage as an adult. It's something that children can't do, teenagers can't do. But alcohol is a drug, just like tobacco is. And while I think it's fine to have a drink, I think drinking in moderation is always important. If you already have chronic kidney disease and you're drinking 2, 3, sometimes more alcoholic beverages in a day or an evening, that is going to contribute even further to chronic kidney disease. I think it's something that we don't talk about enough. Everyone has been told, don't smoke. It causes heart disease. But there's not a lot of advertisement about limiting alcohol intake. But alcohol is very dehydrating. If I had a bottle of rubbing alcohol right now and I sprayed it on a countertop, it would only take a few seconds before you would look at that countertop and it's evaporated. It's gone. It has a very drying effect on our kidneys. And so I wanted to take this time to say, unless you need that alcohol, and I don't know anyone who is prescribed alcohol, then you really want to limit that alcohol intake. If you are a 2 glasses of wine person, try to go down to 1. That's going to be much better for your body and your kidneys than 2. If you are a 3 glass, or I have a few patients that drink 4 glasses of wine a night, or they drink an entire bottle of wine a night, I am trying to get them to decrease that because it does not help your health in any way. Again, no one's ever prescribed alcohol as a treatment. Controlling your blood sugar if you're diabetic, think about syrup. If you have syrup running through your veins, that is not going to be as healthy than if you have water running through your veins. So uncontrolled diabetes, high sugar levels, that is going to contribute to kidney disease. And then you want to watch over-the-counter medications. We all know Tylenol is typically the recommended over-the-counter pain reliever for adults. If you have a pain, we usually say, have you taken any Tylenol? If you have a fever, have you taken any Tylenol? That's our recommended over-the-counter medication because we know that it can cause liver disease, but only in large, persistent doses. But ibuprofen, Aleve, naproxen sodium, those medications are anti-inflammatories, and they are nephrotoxic. So they, in persistent or large doses, they can damage the kidneys. So you have to be careful about what over-the-counter medications you're taking because you don't want to cause further kidney damage. What questions do you all have? Where's Mr. Gray? I didn't answer the question, did I? Pretty close. Yes. Yes. So the question was, if your urine is completely white or pale, should you keep drinking? Yes. One thing we didn't talk about, and I'll bring this up, is a GI illness. If you've had diarrhea, if you've had vomiting. So we talked about urine production, but we didn't talk about other ways of losing fluid. We talked about sweating and urinating your fluid out, but we didn't talk about if you have diarrhea or vomiting. If you have a GI illness, you want to rehydrate, and you have to do it slowly. You can't go from vomiting 1 minute to drinking a glass of water, right? We all know. Everyone's sitting there going, oh, I can't imagine putting anything in my mouth right now. The way you hydrate slowly after a GI illness is tablespoons. You literally take small amounts of liquid every 15 minutes because even if you vomited or even if you've been to the bathroom and had diarrhea multiple times, taking a tablespoon of water every 15 minutes, and if you're able to keep that down, then you can slowly increase your hydration. You just don't want to try to drink an entire bottle of water if you've been sick. What other questions? Yes? Vitamins can have an effect on the color of your urine, yes. So oftentimes you'll take a vitamin. Your vitamin goes into your stomach. In the small intestine is where it's digested, broken down, and absorbed out into the bloodstream. But oftentimes vitamins can cause a very bright yellow or a bright orange color to your urine. And it's not such a bad thing, but it shouldn't be persistent. So as you're continuing to hydrate through the day, your urine should become clear. There's not. There's no particular brand that won't do that. Some people do believe talking to your pharmacist and getting a pharmaceutical grade brand. So vitamins and supplements are not monitored by the Food and Drug Administration. They might be made in China. They might be made in Turkey. We don't know what kind of additives there may be in the vitamins. So when you take over-the-counter medications, you have to be mindful of where it's made, where was it manufactured. But there are some pharmacies that will sell pharmaceutical-grade vitamins that have a purer form of the vitamins. So you can always talk to your pharmacist about whether or not they carry those or not. Yes? Oh, well, it depends. So what temperature do you recommend for your apartment? It's wherever you want to keep your temperature set to be comfortable. But just know that if you're keeping your temperature set at a higher level, and I'm going to say 75 or higher is pretty warm, then you're probably losing more fluid through your skin than you realize. You may not be beating up with sweat, but you are losing some of your fluid through your skin. So cooler temperatures are going to keep you better hydrated. So that was why we talked about that. Anyone else? Yes, Elaine. Probiotics. If you asked me, hey, Lori, what vitamins do you like? What supplements do you like? What should I spend my money on and what should I not? I could run through a list. Maybe we should do a talk about that at another time. I do like probiotics. I think probiotics are very helpful for people who might have a very sensitive digestive system. They have maybe irritable bowel disease. They've been on antibiotics recently. They've been in the hospital. I don't think they're good for all, so I don't think everyone should just go out and go buy them. I would definitely talk to your provider or talk to your gastroenterologist and get their opinion. Every person you kind of have to take into their medical history and look at things. Definitely during antibiotic use or after antibiotic use, probiotics are helpful. It does. It helps restore the bacteria that got eliminated with antibiotic use. So we know when we are treating a bladder infection or when we're treating pneumonia, we're treating you with an antibiotic. That antibiotic goes in through the mouth and into the stomach, but it does not know to only go and work on that pneumonia or only work in the bladder. So it is going through your digestive system. It is killing some of the good bacteria that we have. Good bacteria helps break down, helps aid in our digestion, helps form our stools. And so if you're on antibiotics routinely, you're eliminating a lot of the good bacteria. And so taking a probiotic can help restore that normal, we call it flora, normal flora. I do recommend a good probiotic. So, making sure you're checking with your pharmacist about the best brand. I wouldn't buy one from Dollar General. I'm very surprised by these dollar stores that are now selling medications. You will not find me buying my ibuprofen or Tylenol from the dollar store. I just don't trust it. Yes. So milk or almond milk, yes, they do count towards your hydration goals. Skim milk is going to be your best water content. It has the most water content than any of the milks. The thicker the milk, the less the water content. The thinner the milk, the more water content that it has. So that does count. It's usually the dark beverages that I say stay away from. If you have a choice of a Coke or a Sprite, I would go with the Sprite. The Sprite is a clear fluid, and it's the dark caramel coloring and other additives that are added to things like sodas that can cause further kidney damage. Anyone else? I know we've been talking for a while. Yes? Right? Yeah. So the question is, sometimes we go out to dinner, we start with a glass of water, we squeeze in a lemon, we add a little sugar substitute, maybe some Splenda, Equal, something like that. That is still going to count towards your hydration because it is water-based and it's not changing the color of the liquid. Water is still best. I always go back to saying, if it's in a plastic bag, if it's in a plastic bottle, I mean, you know, bottled water is bottled water, but if it's in a container, this is a supplement. So water, fresh water is always going to be best, but for those people who just don't care for the flavor or the lack of flavor in a water, adding lemon and adding a sugar substitute would be fine. There are some times that I have purchased like a Gatorade when I've been dehydrated, and it is so sweet that I almost can't drink it. I will water it down with water. They do make certain electrolytes that are half sugar or Gatorade Zero, G0 or G2. I think the G2, I'm not sure if they're still making that, but that was half the amount of sugar. So, and a lot of those do have food coloring in them. You'll notice with these packs of Propel, even the grape one, you will pour it in your water bottle. Take a sip out of your water bottle, pour it in there, shake it up, but it doesn't have any food coloring in it. So I do like these. These are 5 calories. And actually, I've got the package here. And if I have my reading glasses on, I can tell you. These are 5 calories. These contain 260 milligrams of sodium, which can be a lot, but if you're dehydrated, then you actually need a little sodium. This has no potassium in it, so Propel is good for anyone who has a high potassium level. So there's no potassium. There's 45 milligrams of vitamin C in these packets, and that's 50% of the recommended daily value. You get 50% of your vitamin E. These have vitamin B6, vitamin B12, and niacin in them. I think that these are great. This is what we have at our house. This is what my kids like. It's funny, when I go to recycle a water bottle, I'll pick up a water bottle that's empty, and I'm like, was this water or was it Propel? Because you can't tell. It doesn't have any coloring to it. And I'll sniff the lid. And then I go, oh, okay, it was Propel. Let me go rinse this one out before I put it in recycling. But it does add some flavor to it. It's not too sweet. Just gives you something different, an alternative to plain water. Yes, Miss Joyce. Crystal Light's probably about the same thing. I have looked at Crystal Light packets. They don't have as many vitamins in them, so they don't have as much sodium or potassium in them. Oftentimes, it's more just flavor, but you just have to read the labels. Yes. Do they have artificial sugar? Most of them do have artificial sugar. Yes, ma'am. Unfortunately, they do have something to make it just a little bit sweet. Yes. Oh, well, I've never tested the tap water here at River Landing, but I'm guessing that's city water. We have city water at my house. I do drink it. We have one of those little nugget ice makers that sit tabletop. We try to filter our water before we put it in through our machine. So a water filter is nice. You can buy the water filters that attach to your faucet, or you can buy the pitchers of like Brita water filters that have a filter in the top of it. If you're unsure about the water, you can always buy a filter for it. But yeah, probably a whole nother discussion could be, well, what about the acidity of water? What about alkaline water? There's so many things on the market, and I am certainly not a professional when it comes to that. One thing I was going to mention, there is a brand called Hint, H-I-N-T, and it's basically water that has a hint of flavoring. I can't remember if it has an artificial sweetener in it, though. So for people who are very sensitive to super sweet flavors, you might want to look at Hint water. It's clear. It comes bottled like this. Oftentimes you can find it at Costco or Sam's. Yes, Mary. Lemon juice. Yep, lemon juice is acidic, so any citrus, so lemons or limes can help kill bacteria. So for some people who are struggling with kidney infections, bladder infections, urinary tract infections, squeezing that lemon into their water or using a packet of True Lemon or True Lime, which is just crystallized, it should also do the same. It's going to have that same flavor. It's going to have that same acidity to it. Anyone else? No. Well, thank you all for coming.